I'd now like to pass on to Sue Yell, who heads the Community Wellbeing stream. Sue is at Federation University, and you can see that she has quite a few colleagues there assisting with this stream. Over to you, Sue.
Thank you, Michael. Hi, everyone. So in previous years, and as I reported last year, the Community Wellbeing stream's been tracking the community's wellbeing and recovery since the mine fire. We'll continue to do this over the next few years, but we've broadened our scope to look at the impact of other significant events since the fire. So quite a few things have obviously happened since then. We've had closure of the Hazelwood mine and some other large local employers. We've had the Black Summer bushfires, and of course the COVID pandemic. But there've also been some positive initiatives, like the formation of the Latrobe Valley Authority, the Health Innovation Zone, the Latrobe Health Assembly, and the appointment of the Latrobe Health Advocate, as well as, grassroots initiatives by local government and other organisations. So we want to continue to track a range of events and initiatives. We are conducting interviews to gather data, so 2 rounds of interviews are planned, and we've completed the first round earlier this year. It was a little delayed due to COVID, but we were very grateful to 30 community members and stakeholders who participated in those interviews. We asked them how they felt the Latrobe Valley community's wellbeing was travelling, and what factors impact on this community's wellbeing. We also asked about their individual sense of wellbeing, and that was in order to gather some data for the Psych Impact stream to address their research questions. A major new activity that I mentioned around this time last year in our last year's briefing is the Community Wellbeing Barometer. And the aim of the barometer is to capture changes in community wellbeing and how the community is impacted by significant events. So this depicts where our thinking is at with the barometer. The team's identified the 5 broad areas you can see in the centre that impact on community wellbeing: health, the economy, the environment, services and infrastructure, and social connections. And we've broken these down into some related themes. We showed a diagram of the barometer to our interviewees and asked them to comment on those domains and themes, and just to tell us whether they thought that model captured the factors that most impact on the wellbeing of this community. And one of the things that our interviewees pointed out is that the 5 domains are very interconnected, which is why we're depicting them in this kind of circle format. But yeah, there's a lot of interconnections. So the environment, of course, impacts on health, but also on social connections, where people feel that, there are environmental spaces, green spaces that encourage people to get out and connect with one another. Employment status impacts on mental health, and physical and mental health are deeply connected to one another. These are some more insights gained from our first round interviews. We're obviously still doing a complete analysis of that. The social connections domain was seen as the most important of all the domains for community wellbeing. Certainly major events had both positive and negative impacts on connectedness, because when they occur, they often limit opportunities for people to gather during the event, but they also trigger strengthened bonds as people support one another through recovery. And the environment domain is a pretty interesting one for this community. There's a pretty complicated relationship with community wellbeing. Some environmental issues are seen as the catalyst for community members coming together to address those issues and lobby for change. When community members disagree with decisions made by government on environmental issues, that tends to translate into a level of mistrust in leadership, and that mistrust can then impact on people's sense of certainty regarding the region's future. So, for example, will the future be green or dirty in terms of industries? The health domain is overwhelmingly identified by participants as being the domain that's really sensitive to change in response to major events. And that, of course, seems pretty obvious in a way because of the type of events that we've had impacting on our region, including the mine fire, the bushfires at different, different points, large industry closures, and more recently the COVID pandemic. And all of those events have links to physical and or mental health impacts. So our future plans are, our immediate next step, which is currently underway, is to identify appropriate measures and data that we can use to track each of the barometer domains and themes. And we'll look to publicly available data sources like the ABS census data. When we've finalised the components of the barometer, which we'll go back and check again with our interviewees and stakeholders, we'll use it to gather data to measure changes in community wellbeing at probably a number of time points, including before and after the mine fire. Ultimately, we aim to share both our results from that and also the barometer tool itself with other interested organisations, such as La Trobe City and the Health Advocate and Health Assembly. The mental health and wellbeing follow-up survey that was conducted by the Psychological Impact Stream in early 2020 included a series of questions about aspects of community wellbeing, and the Psych Stream presentation will talk a little bit more about that in a moment. So we'll conduct another round of interviews with stakeholders and community members in a couple of years to see if their perceptions of community wellbeing have changed. And then we'll put all these data sources together to see what they tell us about community resilience as well as vulnerability. And finally, we'll continue to look at impacts on older people and what we can learn from our elders. We've had a book chapter and editorial published last year on the resilience of older people during disasters. And age is continuing to be one of the key factors considered in the analyses arising from other streams. And that's it from me.